2, you're on.
G'day, Sean Thompson here from Australian Imaging. Today we're at Nundah Village Dental with the Principal Dentist, Dr. Marc. How are you, Marc?
Fantastic, thanks Dave.
Good. We're here to talk about the Dexis OP3D. So this particular site's had this system for how long?
February this year, so 9 months.
9 months. Obviously, when you were looking at systems in the marketplace, what were the main drivers behind sort of buying this particular unit?
Look, one of the big points, an associate had met you guys at a conference, and it was the integration to get the reports and the support on how to do that, so that we could just feel that we were in a safe environment, that it was easy to install and everything just worked, and that's what we've found.
Yeah, so from a workflow perspective now, you basically just have everything in-house?
Yes,
so everything
yes.
in-house?
We don't do ortho or lat-cefs, although you could set it up for it, but we do our cone beams, we do our OPGs. It goes straight into the computer, you hit send, it's exported, the reports are sent off, and then we just get the reports back later on. So it just saves that break in the cycle. The patient can have it done right now, and we can see it and we can move on.
Yeah. You mentioned before about the reporting. Obviously, we work closely with MFI Radiology and being able to provide a service where we supply the imaging equipment, they supply a proper dental maxillofacial report. How's that helped the practice?
Yeah, the reports are just that peace of mind for me. So I know that we don't have to get a report, but I know that I don't have to think about it. It's the same as when I send it to the radiologists, and then the report will just arrive and we can double check it. So the advantage is we've got the immediate image that we wanted to see that day. The patients come in for whatever treatment or a diagnosis, and we know, but then we're getting the safety of that report coming back within 24 hours, 48 hours, something like that.
Fantastic. One thing I do bang on about with dentists when I'm talking to them when they're going to buy a cone beam CT is the after-sales service support and training, which I think is imperative. There's a lot of companies selling cone beam CT. So what's your experience been from the time the system's gone into to this point?
Absolutely. Well, we had a full training day with all of the staff. It seemed daunting at first, and the machine is really easy to use. The images are so clear, better than we were getting by sending them out. So having that in-house has been fantastic. Having an option to do bite rings as well, although we haven't had too much, but all of the imaging is just so clear to what I was used to in the past.
Fantastic. Thanks so much for choosing Australian Imaging, and your practice looks beautiful.
Thank you.
Compliment on that.
We've
Thanks,
been
Marc.
really happy with it.
Thank you.
Great.
So one take.